So why don't we start out with, why don't each of you just take a minute or two just to tell us who you are, what's on your minds, what it is you've been doing the last 5 or 10 years, and what you're thinking these days. So Dr. Funk, why don't you start?
Okay. Good evening, everyone. My name is Dr. Kristi Funk. I'm a board-certified breast cancer surgeon, as you heard. I live in Los Angeles, and for the last 5 to 10 years, I've been really honing my practice to be very balanced in terms of approaching women's breast health and then disease when present with a multi-pronged approach. Obviously, as a surgeon, I do surgery. It's not always necessary for the things that I see. Sometimes I see breast pain or nipple discharge, and I'm just diagnosing issues and offering advice. But I've really focused on how to help women feel empowered by the choices that they're making and how that directly impacts their breast health and their outcomes if they've already been diagnosed with cancer. I became board certified in lifestyle medicine in the last year, just for more street cred, really, and also following my own advice, which is to always be learning something new, right? The idea of grow or die and neurogenesis and plasticity are real, and you want to stimulate yourself. So that was one challenge I set before myself last year and became board certified in lifestyle medicine, which just furthers my ability to understand and then advise regarding how things like sleep or social connectivity really do make a cellular impact that makes your life not only healthier, but more joyful. So that's been my main focus professionally. Personally, I have triplet sons who are approaching 15 years old, and that could be a full-time job. And I spend a lot of time at home and with family.
Thank you. Dr. Freeman?
Well, it's nice to be here as well. I am a cardiologist in Denver, Colorado, and over the last probably 15 years, I've been honing and developing all the various lifestyle medicine parts of my career. I started doing Walk with a Doc about 14 years ago, where we walk with our patients, and then slowly started to change my own personal diet growing up in New York, living and eating the terrible New York way. And I too am originally from Long Island, even though I don't have that accent. And then when I did that, not only did I personally lose 30 pounds of fellowship gained weight from Philadelphia cheesesteaks, but I actually got a rebate check in the mail from my life insurance company, which I thought was pretty amazing. And ever since then, I've been doing this with my patients with incredible results, and it's been really exciting. Other than that, I have 4 children myself, me and my wife, obviously, and that's a full-time job, as you can imagine. But regardless, it's a lovely mix of work and life balance, and probably not as much sleep as I should get.
Thank you. So there are some people that are saying, well, this is a waste of time to watch this panel because, there's no, cancer and heart disease just happen. It's, what can you do about it? It's just bad luck. And so what's the point of hearing more about it? There's nothing I can do. Some people just have bad genes and, it's just really nothing you could really do about them. So is there something that can be done to make a significant difference in the likelihood of contracting heart disease or cancer?
Kristi, do you want to go first? You tell me.
Yeah, sure. I'll go first and tell you that nothing could be further from the genetic truth than to say that the vast majority of all breast cancer has nothing to do with inherited genetics. We know for a fact that approximately 8% of all women diagnosed with breast cancer do in fact carry a gene mutation. BRCA, CHEK2, PALB2. There's a handful of about 19 genes directly related to elevating breast cancer risk. And with several, and maybe not even all of those genes, but with a handful, like say BRCA1, the risk of getting breast cancer is so elevated. And the mutation in that gene, which is supposed to do like DNA mutation cleanup on your behalf behind the scenes, it's so handicapped, and that's such a critical function that most of those women are not going to necessarily outlive the plan of your cells to have this cancer form and then proliferate inside of you. In other words, it's so high risk. I'm not sure you can kill it off with kale and exercise. However, it's only 8% of women. So it's serious and a big deal if you have a gene mutation, but most people don't. Okay. So on the other end of our bell curve spectrum here might be a tiny handful of, I give it 5% of people where it's truly inexplicable. They do quote unquote everything right. They live well. They've been zenned out and meditating since birth. They eat plant-based. They sleep well. They have loving relationships, et cetera, right? They still get cancer. I have a theory about those people as well, but the point is it's hard to explain, but it's not genetic. Here we have the big middle bell curve though, right? We're talking literally 80 to 90% of all women diagnosed with breast cancer who cannot attribute it to a genetic mutation and who in fact have some major room for improvement in diet and lifestyle. This is like my hyper focus because these people can truly be educated and empowered to make small, stepwise, incremental, critical changes that absolutely directly translate to an alteration of the cell microenvironment. The tissues and cells that your own cells are bathing in, feed and fuel it toward disease or away from disease, be it heart disease or stroke or Alzheimer's or diabetes or cancer or something else that doesn't necessarily even take your life, but it threatens the joy in your life. So I'm talking about chronic stress, anxiety, depression, even just joint pain, irritable bowel syndrome, autoimmune disorders. You know, they adversely affect your experience and your happiness throughout the day. And to think that you can control what's on the end of your fork and the decisions you make to how to spend your time. And in controlling those decisions, you are altering your insides and creating a healthful, positive impact on your day-to-day living.
I think those are amazing points, and the analogy I often give, as morbid as it is that your genes are perhaps loading the gun, but the environment that you put them in is like shooting it. And so genetic predispositions are an important thing that we all face. Some of us are very unlucky genetically, right? Your whole family might have potentially had heart disease before 40. And there are some things that we can easily fix. The vast majority of heart disease that's out there is preventable. There are some genetic anomalies, but that's not most of us. And so it's, a lot of those people who say, well, these are my genes and that's it, and I'm going to do whatever I want, I think don't understand that there's been a number of published papers that suggest that your genetics don't have to hold you hostage. It's really the genes, the environment that we put those genes in. And we know from a lot of the epigenetics, the way the proteins are made and then they ultimately fold matters. And that folding often depends on the environment we live in. So I guess what I would tell people is heart disease and cancer actually share a lot of the same pathophysiology. This is why cardio-oncology is such a booming field. And I think that a lot of it has to do with the way we live. Human beings were not designed or destined to end up with heart disease and cancer. I mean, that doesn't really benefit anybody. And so the goal here is to prevent all of that. And that can be done very, very well through lifestyle. And I do want to point out that it's more than just diet, of course. It's the exercise, the stress, the connections we make with others, how well we sleep, avoiding substances. All of these things together really are synergistic in preventing those bad genes from getting expressed the way that we don't want them to. So,
Dr. Funk, when you speak about breast cancer, should we assume that it applies also to prostate cancer and other cancers, or is breast cancer unique?
Breast cancer has some unique differences between itself and other organ cancers. Mainly that 80% of all breast cancers are fed and fueled by estrogen. So to the degree that we can modulate estrogen, bad estrogen in our bodies, we can decrease cancer risk and occurrence and mortality risk. However, everything else that I talk about actually directly translates to the decrease in morbidity and mortality from any type of cancer in your body.
So I have questions to ask you about different lifestyle things, but last year we had a speaker named Chris Wark. He wrote a book called Chris Beats Cancer. And
I know very well.
Yes. And he said that here everyone was all focused on our supplements and our diet and our lifestyle and our exercise and all the great things we could do. And he says, oh, and by the way, you have to forgive everyone. Now, when it comes to emotional health, a lot of us are angry. People hurt our feelings in life. People cheated us. There's a lot of things where we have grudges. Now, is this a real thing? Do we really have to clean up our emotional health and really forgive everyone and stop the anger? And is that a real thing that's really affects cancer and heart disease? Or is there proof of that? Like, it seems a lot of us are willing to jump in ice baths to be healthy, but we're not so sure we're willing to forgive everyone in life that hurt us.
Absolutely. Well, that's a little bit more difficult than just the brave leap into cold water, to kind of forgive others and forgive yourself, takes a lot of ownership, and that can be difficult. I think Chris' work is absolutely correct, and studies, absolutely, I'll let Dr. Freeman expand on this, but for sure, studies have shown a decrease in blood pressure, and cardiovascular outcome can be affected obviously directly by that. It lowers cholesterol levels, improves sleep, and has been shown to lower the risk of heart attack. It has not been shown forgiveness and what is it about forgiveness specifically? It's truly that the act can reap health benefits in that it decreases your adrenergic responses, right? Your sympathetic and nervous system, because it takes energy to be chronically angry and resentful of people. It puts you in a fight or flight mode, right? Which results in numerous changes like your heart rate going up and your blood pressure being high and your immune response being dulled because you're creating some immune system dysfunction when it lives in that chronic inflammatory fight or flight state. And so the studies that I've seen actually do literally correlate forgiveness to calm, which then lowers stress levels that are measurable. So we're talking about IGF-1, C-reactive protein, interleukin-1, interleukin-6, tumor necrosis factor, natural killer cells. All of these are very measurable in your blood, and they've been shown before and after in forgiveness studies to alter. And when you lower reactive cells that create inflammation, you're going to have a better health outcome. So in essence, forgiveness equals stress reduction, which equals a boosting of your immune system and an ability to live healthier.
I think that the vast majority of cardiologists you meet will probably have that type A personality or the intense personality, and maybe some surgeons. Many times people will say that cardiologists are surgeons that didn't want to do surgery. And you probably know what I'm talking about, Dr. Funk, because surgeons often have that very intense personality. And it turns out that personality type is associated with worsened cardiovascular outcomes on a variety of levels. But even the words we use on a regular basis in common parlance, like disease, dis-ease, or lack of ease, when you're angry and you don't have ease, and then hypertension, right? Too much tension. And it turns out that lots of this sort of intense rage and anger that many of us develop, particularly during the pandemic, is not a great way to live. And it turns out that it raises a variety of different issues. In fact, there's even data suggesting it raises cholesterol and increases heart attack risk. So in general, figuring out how to let things go is super duper important and powerful. And many of us have very intense professions where, we have lives at stake. And sometimes we do everything right for a patient and they still die. And then, going back and reflecting at the end of your day, did you do everything you could? Did you go the extra mile? And then forgiving yourself for those bad outcomes, which is a very hard thing to do. So in short, I think, mental capacity and resilience is a really important way to keep people healthy, and it's hard to develop, but it's a skill like anything else, and it takes time to get there.
Thank you. Both Dr. Caldwell Esselstyn and Dr. T. Colin Campbell are going to be speaking at the conference. They're both 90 years old. And Dr. Esselstyn had made a point of using the phrase heart attack proof for people that were following, I guess, the whole food plant-based diet and had a cholesterol below 150. And Dr. Campbell in the China study had said that the rates of heart disease and specifically cancer for people who were eating, I guess, a whole food plant-based diet were dramatically lower. In your experience with your work and your patients, do you find that people that follow this lifestyle don't get heart attacks? Don't get heart attacks? And then do they not get cancer, or do they sometimes get cancer? You kind of answered that, but the cancer, but like, if you do all of this stuff, how heart attack proof are you, and how protected are you from cancer?
Maybe I'll jump in first on this. So first, let me just say that you could be the healthiest person on the planet. You could eat only plants and exercise 1,000,000 hours a day and have no stress and, whatever it is, and you could still be hit by a bus, which would be awful, and it happens. So in short, death is part of life, unfortunately. And so figuring out when that is and trying to delay it is important. But what I want to point out is the American curse is a real thing. People work hard their whole lives, they save their money, they get ready to retire, and then what do they look forward to? Not death, but suffering first with heart attacks, strokes, breast cancer, right? Dementia, erectile dysfunction. It's a terrible way to retire. And so the question is, if we live this way, can we live into an older age feeling well and doing well? And it's one thing to be alive, and it's another to be alive and well. And so my personal hope is to be a grandparent or maybe a great grandparent and be dancing with my great grandkids at their weddings or whatever happens in their lives, rather than being drooling to myself in the corner like many old people in the United States, which is unfortunate. And so figuring out how to get there is important. And when we make these lifestyle changes, it is not a guarantee, right? So when I went plant-based, nobody issued me a guarantee that says you shall live to be 120 years old and feel great. I mean, that'd be lovely, but they didn't. But rather, this is a hedge against my genes, if you will. So as I mentioned earlier, your genes don't have to hold you hostage, but at some point aging occurs and sometimes your genetics do play a role. And we all know people who can live to be 119 and drink out of a fryer and smoke a carton of cigarettes a day. And they're very lucky people, but you don't know you're that person until you get there. So making these changes now will hopefully make it much more likely for me to live to a riper old age, feeling great, doing great things, and maybe I'll be lecturing, until I'm 100 instead of 90. Who knows? But my goal would be to avoid the common American ailments if I can.
Thank you.
And for my answer, I think if you are someone who's really grasped and implemented the recommendations of doctors Esselstyn and Campbell,